sayfa girdi üzerine. Bağlantı yok.
Telefona bakayım da.
O zaman şey yapıyorum. Düzeldi mi?
Ama yine şey değil.
Tamam. En azından. Yayındayız.
Hello, sorry for the technical issues. I think we are on leave right now. So we just want to wait a couple of minutes to you to join. So maybe we can wait like 2 minutes, then we can start with introducing ourselves. Then we will talk about the diet and the process all together today. And on last 10 minutes, we will get some questions from you and we will answer all of your questions, hopefully. But let us wait like 2 more minutes. We can wait 1 more minute, right? Okay. Okay, then. So let me start by introducing myself. This is dietitian Duygu from Clinic-Up,
And I am dietitian Eda from Clinic-Up.
so we are actually 3 dietitians here. Dietitian Berna is not here unfortunately, but she is manager of nutritional department, and 2 of us are doing the nutritional follow-ups for Clinic-Up bariatric patients. So we just want to answer all of your questions today, and we just want to try to inform you about the pre-op and the post-operative process and the diets, please. But first, I want you to talk about the pre-operative process, then maybe we can talk about the other procedures together.
Sure. For the preoperative process, we are aiming to reduce the volume of the liver actually, because like this we are going to reduce the risk of the after operation complication problems too. And we are seeing your reports and we are calculating your BMI, and then after we calculate your BMI, according to that we are calculating for how many days you have to do this preoperative diet, and we are sending you this from the 15 days before. But if you have like questions about it, you can always ask your coordinators about it and let us know too. We are all here to help you and support you in this process. And in this preoperative diet, we are aiming to, like I said, reducing the liver of the volume of the liver, and we are doing a liquid diet. We can have like decaf coffees, decaf teas, but we are paying attention to them to not be like sugar addition in them. You can have sugar-free puddings, yogurts, actimels, all okay. Like well-blended soups, all okay. You can have kefir, probiotic yogurts, probiotic drinks. lactose-free or normal liquids. They are all okay in this process, but we have to avoid like solids in this diet. So yeah, it is like this. We are aiming to reduce the volume of the liver and reduce the complication risks.
So how long the patient is doing the liver reduction diet? Is it like 2 weeks or less than this?
Yeah, actually, we first see your reports and then we are calculating your BMI and we are seeing other problems in your report too, and we are calculating this duration of this diet according to your BMI and the other issues in your medical report. So it changes to person and it is very unique actually.
Okay, and actually as Klinikap bariatric dietitians, we provide you 2 years dietitian support, and we just want you to inform that it's not starting from hospital, because we contact you before your surgery, so 2 weeks before your operation. So if you want to ask anything, you can just contact your dietitian. You can ask some products, or if you have any questions about nutrition, you can ask us anytime. So we just want you to be ready before your operation. So when you come here, actually, we will of course see you like face to face here at the hospital, and at there we will inform you about the liquid stage that we will be on, like 7 to 10 days. It definitely depends on the patient, but in general we want you to do the liquid diet after the operation. And for you, we also provide you some supplements here, which are all bariatric supplements. We provide protein powder, we also provide you multivitamin and water drops here for free from Klinikap. We will all introduce these supplements for you. Of course, we can also help you to how you can prepare it, so we don't want you to feel alone here. At the hospital, on the second day, we will also provide lactose-free milk for you to prepare your shakes, etc. When you go back to your country, we can also recommend something that you can find in your country. We also have some documents about that, or if you want to get some product, you can just send a food label to us so we can inform you about when you can start to have that or how much portion that you can have. So if you can just keep in touch with your dietitian, actually it will be better process for you, because you know the surgery is just a tool, but we still want you to change your lifestyle and the eating habits with the diet and exercise, please. And we just wanna be with you on this journey. We don't want you to feel alone. Also, we are here for nutritional follow-up, but Klinikap also has some doctors, post-op doctors. So if you have any medical issues or if you have any problem with toleration, etc., we do also have some doctors that you can get information by WhatsApp message, or if you need any video call or something. So for medical things, you can contact your post-op doctors anytime. For nutritional things, you can contact your dietitian anytime. If you need any document or something extra, you have your coordinator, so you can contact them anytime. So when you come here, we are like a family at the hospital, so you're not gonna be alone. But even when you go back to your country, we still don't want you to feel alone. That's why it's really important for Klinikap, for patient satisfaction. As dietitians, you can be sure that you're not gonna be alone. So we do have some checkup days to introduce new foods to your diet. Also, we do check your weight loss. If there's any problem with your weight loss or diet, we also inform you about that. We follow all of our patients individually, because every patient, everybody is unique. So your weight loss will be, of course, different than the others. Your cousin can have the surgery with the same doctor, same time, with the same weight, but everybody is different. Every metabolism is different. So let's not compare yourself. If you have any questions, do not write on Google, just ask the professionalist so you can get the best personalized advice. Of course, we do some checkups, but if you have any questions, you can message us anytime. We have like 12 control days, right?
Yeah.
Maybe you can also inform them about our control days. How often do we write them?
Yeah, actually we have a booklet too that we have prepared for you. and we are giving this booklet for you to not get lost. We know that there is a lot of information on the internet, so we are giving you this booklet to not get lost and search information online. And like Duygu said, we have like some checkup dates for the first month. We are contacting you weekly, and after that we are contacting you in 2 weeks, and after that monthly. So you're not going to be alone in this journey. We are all here to support you and help you with this process. Yeah.
Perfect. So also every 3 months we want you to do your blood works. We also check these things. If you need any medical advice, we also inform your doctor, them to assist you. So the thing is, you need to lose weight with a healthy way to not regain the weight after 1 year or after 6 years. That's why we don't want you to feel alone. So we are all here to inform you about the diet process. If there's any stall with your weight loss, or if there's any problem with any other issues about the diet, we can send another diet for you, and we follow you closely. So fortunately you're gonna reach your goal weight, but the thing is to maintain the goal weight when you reach that. That's why it's really important. We do also have some programs like weight maintenance program for you. So when you reach the goal weight, if you can inform us, we can send another diet plan by arranging the calories for you. Or if you have any health issues, or if you have any pregnancy, etc., we can send another diet plan for you. So you know, if you need any help, just let us know.
Yeah, and you don't have to wait the control like checkup dates. You can always message us, and we are going to support you in this process every time.
Okay. So basically, before your operation, you're gonna have a liquid stage for 3 days or 14 days. Then when you come here, 1 day before the operation, you will do all the tests at the hospital. But at the hospital, of course, you're not gonna be alone. We have some hospital coordinators. During the day, also, we do have coordinators for the night shift as well. So you will do all the tests here. Then on that day you will be on the liquids, but the hospital staff will provide the soup or compote juice, which is like a juice for you. So you will have all the liquids, and the surgery day you're gonna have the operation. Then after then, the surgery is just like a 25-30 minute thing, as you know, for the gastric sleeve. But after then, when you wake up, you just need to do walking because you might have some gas problems, etc. But the other day, hopefully you will start having some liquids by your doctor recommendation, like sipping some water. We will also come to see you and inform you about how you can have, because we need to drink everything slowly, like sip by sip, to not have any vomiting, to not have any nausea. But the other day, of course, for the first day you will get an IV, but the other day our team will provide you some medications that you can start, and we will also come to provide you protein powders you to not lose the muscle mass on your body on the second day post-op. We want you to start. Each sachet has like 27 gram protein inside, and it has different flavors, so it's really tasteful. I hope you're gonna enjoy. So after then, the other day when you discharge, you will be able to go to your country, you will be able to fly, or you might have some like hotel stay from your from Clinic Up if you want to stay 1 or 2 more nights, because at the hotel we have some staff from Clinic Up, like patients relations, post-op doctors, nurses, like 7/24, so you're not gonna be alone there. And when you're staying there, we will also messaging you. If you want to go Turkish supermarkets, we can also recommend something about your liquid stage, or if you want to buy something else, we can also check for you. So finally, when you go back to your country, you will be on the liquid diet for 5-6 days more. But when you will be at home, you can make your own soup, you can get some other products from your country. So I think day by day you will tolerate more liquids, so you will enjoy more, right?
Yeah, exactly. And in this booklet there is a lot of recipes to prepare in every step. So you have different options when you go back to your country too. You can prepare your own food at home and try different things. We have a lot of recipes, and we are going to send you a lot of different documentation for that too. So you can try new things, you can adapt new things to your diet too.
Yeah, we have too many patients from UK, but we do have from Romania, from USA, and we have some patients from Nigeria. That's why we are trying to make a diet plan for your culture as well. So just let us know what your culture is, or just let us know what you want to have, so we can talk about the recipe, or we can talk about how much portion you can have. We just want you to follow the diet, but we just want you to enjoy too. By the way, almost 10 minutes we want to answer your questions, so if you can just write on the message box, we can just read and answer your questions if you have any. I think there is no questions, right? Okay. So diet means actually changing your eating habits. So for the first weeks it can be hard for you, but actually after 3 months you will be able to consume and tolerate anything. So it's not that much like scary, I think, right?
Yeah.
So especially on the first 6 weeks we want you to follow your diet properly, because you might have some health issues due to your nutrition. That's why we don't want you to have something solid on the first 10 days or something spicy on the first month especially. These rules are just for your stomach healing, but after 6 weeks you will be able to have like maybe raw vegetables, you will be able to have some spice, some caffeine, etc. So your diet will be like much more food. But after 3 months you can even have maybe alcohol, but we will just talk about how much you can have on occasional days, of course. It depends on the patient, so we just need to follow you individually, then we can maybe inform you better about your diet.
Yeah, the process is it's different for each person, so it is very unique for each person actually. It changes the person to person very much, but we are very happy to support you in this process individually. So if you have any questions, you can always message us. You are welcome to write us anytime.
A lot of patients is asking when they come here, when can I eat normally? So how can we answer this question then?
Yeah, actually, it changed a lot too, because in the first month, like Duygu said, especially for the 6 weeks, we are doing like step-to-step diets, and in each step we are introducing something new to your diet, and we are like doing this according to your toleration levels too. Yes, day by day your toleration levels are going to increase, and when we introduce new foods to your diet, they are going to increase a little bit more, but it changes person to person so much, so it is a little bit hard to say yes, you can have normal foods in this day or this day. So it is a little bit hard to say like this. Yeah,
Definitely. So
there is a question says, when can we drink tea and coffee?
okay, especially for the first month, we don't want you to have any caffeine, please. But decaf coffee or decaf tea is all fine after your operation, second day of your post-op. But the thing is, we want you to drink water as much as you can. That's why after your first month, if you can tolerate like 1.5 to 2 liter water without any problem, you can have 1 cup of coffee. But we want you to prioritize your protein and the water intake. That's why we have some rules about that. But for the first month, everything must be at the room temperature, please. So not extremely hot or the cold things for the first month. Like herbal teas or decaf teas are all okay, or decaf coffee is all okay. But not caffeine for the first month, please. Other questions for you then. I walk every day, but when can I go to the gym?
Yeah, for the first month, we just want you to have like 50 minutes, 60 minutes walks. But after 1 month, as long as you don't have any discomfort or any pain or any problem with your stomach or with your surgery, you can start doing exercises like slowly. You can start doing gymming, or if you like a sport like tennis, swimming, you can do that. But for the first month, for the healing process of your stomach, we want you to have like walks, like 50 minutes, 60 minutes walks per day. Yeah.
Okay. The other question is, I had a gastric bypass early June with you, but up to now I only lost 15 kgs. I'm so worried. I don't know if I'm doing something wrong.
Yeah, for this question, like we have to remember that this process is unique for everyone. Like one person can lose 10 kg, 15 kg in 2 months, 3 months, and the other one can lose like 20, 30 kgs. And like we are actually, we cannot say this is bad or this is good. Like the whole process is very unique for each person, so we cannot say this is good or this is bad. Yeah.
Definitely. Just contact your dietitian, please. If we can get a food consumption record from you, we can give better advice for you, or we can just make a diet plan which is personalized for you. Then when you follow the diet plan, when you do exercises, when you have enough water during the day, you will see that you're losing more weight. So just let us know your food intake so we can check your calories, we can check your protein, carbohydrate and the fat intake, then we can advise you something. So just tomorrow morning message your dietitian, so we will be assisting you.
And the other question is, when can I get back to work after the surgery as a nurse?
Hello. So actually it's definitely up to your work, but our doctor is generally saying that if you don't have any physical job, after a week you can start. But if you're a nurse, I mean if you have night shifts, etc., maybe after 10 days to 2 weeks you can have more energy maybe. It's also definitely up to the patient, because sometimes the patients are going shopping on their second day post-op.
Yeah.
If you can get your protein powder, if you can get enough liquid in your body, your energy level will be up, so you will be able to start your work when you just go back from here. So it's up to you. Let's see your body then. Okay, so any other questions about nutrition or the process, so we can answer all? I was wondering if you ever came across a similar case, please. Of course, we have seen more than like 2,000 patients here. That's why we have seen lots of cases here. But we don't want to say anything general, or we don't want to say you are slow or you're doing fast. We are just informing you about just yourself. That's why just contact us so we can give personalized advice for you.
Yeah, and one person says that I went back to work 4 days post-op and I was fine. Yeah, like this. Actually, it is definitely like this. Yeah.
Are there any discounts at the moment? We need to ask that to our managers.
Yeah.
So we have sales coordinators and the managers. There's a big staff here actually. They're all doing these discounts or something. So you can also contact your coordinator, or if you can just write your phone number or email details here. Maybe our managers can assist you as well for the prices and the procedure.
Where are you located and what is the price? So like Duygu said, for the prices you can reach always to our sales coordinators about the prices. And we are located in Istanbul, Turkey.
We are performing our surgeries here in Istanbul, but we do also have some consultations in UK, London. So you can also check our Instagram, which is Klinik-Up Bariatric. You can join our Facebook group, which is Klinik-Up Weight Loss Group. It's like a private group, but it's really so motivational for the patients who want to have the surgery or who had the surgery, because they're all real and they're all sharing their journey. So when can I start going to spa, hammam, if I had rhinoplasty July? So it's better to ask the coordinator because rhinoplasty is a plastic surgery, so it's better to ask your surgeon first if he allows you to have another operation or another like spa or something. It will be better to get information from him. So we also want to inform you about the diet content. So it's a bariatric diet actually. A lot of people are sending some popular diets to us, which is maybe juice diet, keto diet, slim fast diet. So they are just asking, my friend lost some weight with this, can I do that? Especially after a month or after 2 months when there's a weight stall or something. So we don't want you to follow any popular diets or any diet plan from others, please. It's really important you to follow the bariatric diet which we provide for you. So if you want to have something different, just let us know, because not the popular diets are helpful, is it?
Yeah, we are hearing so much like I tried this diet and when I finished it, I regained all the weight I have lost. So it is very important to have a regular, like healthy, a balanced diet, not the popular diets, because when we finish them and drop them, we are going to regain all the weight we have lost. Yeah.
We have like 3-4 more minutes, but I just remind that we have talked about gastric sleeve surgery a lot, but we do perform the other procedures for the weight loss as well. So we do have gastric bypass. Our surgeon is doing gastric bypass, or we have gastric balloon if you just want to lose like 15-20 kg. It's also like not it's not an operative process. So if you wanna just lose 15-20 kg, you can also have gastric balloon. We also have nutritional support for clinic up. So if you just want to follow a diet, if you don't want to have operation, we do also have some consultations for you, which is 1 month, 3 months, or 6 months package. So if you just want to lose weight and don't know what to do, just contact your coordinator, so they will find the best solution for you by asking your surgeon or by asking the medical team, so you will get the best advice for yourself.
Yeah.
We have some other questions, I think.
Yeah. How many hours is the surgery? I think Duygu said that it is a very quick surgery actually, like 25 minutes, 30 minutes surgery.
Gastric bypass can be longer, like 1 hour or 1.5 hours. It's definitely up to you. And gastric balloon is like maybe 10 minutes or 15 minutes. So you don't need to stay at the hospital after the gastric balloon. So you can just stay at the hospital, then after that you can just go to your hotel on the same day.
And in terms of the gastric bypass, is how long is the liquid stage, please? Is it 14 days?
Hello, Kay. Yes, we are waiting for you for this month. We remember your name. Gastric bypass, it's definitely up to you. We don't want to say anything, any number to you. We cannot say like 14 days or 15 days, but we can say it's like 7 to 14 days. So it's up to you. But when you come here, second day of your post-operative day, we will inform you about the liquid stage duration.
Yeah, in the checkup days, we are going to ask you some questions about how are you feeling, how are you like how is your toleration levels, do you tolerate all the liquids, etc. And if you have if you don't have any problem, we are going to go further to other steps. So yeah, we can't say an exact number actually.
So there is a good comment here. I wanna say that I can tell you that the price is good as gold, but I was amazed with the service, which was wonderful. So thank you so much. We want you to feel here like a princess actually. That's why we are all here to assist you. We don't want you to feel alone in Turkey, in Istanbul. That's why we don't want you to be alone at the hospital as well. That's why thanks for your comments. The other question is, any advice on how to keep protein down, like chicken after 3 weeks, as I feel carbs are easier on the stomach, but I'm trying to eat more protein, but I cannot eat much.
Yeah, actually for this question, I suggest to my patients that prepare new recipes in every week. Like I said, there is a lot of recipes on our booklet too, to keep the protein we want you to have like chickens, meats, turkeys, all that, but to have like different recipes, for example, for different cooking techniques, you can follow this diet a lot easier.
And we can say that the chicken is hard to digest on the first week, so you're not alone, no worries. Just ask your dietitian about what you can get as a protein, so maybe we can also send some alternatives for you, because chicken is not the only one. So you can get egg if it's okay for you, or you can have cheese if it's toleration better than this. So let us get 2 more questions. So I want to ask that for the gastric balloon, once we lose the weight, can we take it out after 1 year or so? Let me answer this one. Actually, with the gastric balloon, we have 2 options, for 6 months or for 1 year. That's why just aim your goal. Just put your goal. So if you just want to lose 15-20 kg, so 6 months will be okay for you. And when you reach the goal weight, let your dietitian know, so we can arrange a calorie intake for you to maintain it. But if it's 6 months balloon, we want you to remove it on your 6 month, please, for your health. Or if it's 1 year balloon, please do not wait like 2 years. Come here to remove it, or it will be better for your health. That's why please choose the right balloon for you. But of course, you can ask your coordinator and ask your surgeon about which one is the best for you.
Yeah. We have comments like, "We're amazing, what a wonderful session. Thank you so much."
This is our first YouTube channel, Liv. So we are so happy to have you here. So if you have any other questions, by the way, you can ask from Instagram, you can ask from Facebook group, or you can ask from YouTube. So we are going to try answer all of your questions. So it has been like 35 minutes. So I hope it will help you.
Yeah.
So if you have any other questions, please let us know from our Facebook, Instagram pages. So we will answer there.
Yeah.
Okay then. Perfect. So have a nice evening to anyone.
Bye bye.
Bye bye.